me Gayatri Prakash and welcome to my page. Ellavarkkum ende page lottu swagatham. So today I would like to discuss with you all about 24th of September 2022 OET exam, in which I would like to discuss with you detail about OET writing. Okay, so let's move on to the case note. What was the letter? It was a simple referral letter, writing a letter to a community nurse who is going to look after our patient by doing home visit after being discharged today. Okay, so what is the patient name? Patient name is Mrs. Briley Boswell, and her age is 76 years old. Actually, she is living on her own. She is using hearing aids, and also she has hypertension. She is on amlodipine 5 milligram for that. What happened to the patient condition? Why she got admitted? Actually, patient has a long-term history of arthritis, and thereby doctor was suggested her to undergo for the total TKR. Unfortunately, her condition got deteriorated and she developed with a venous leg ulcer, and thereby as per the doctor's advice, she was on compression therapy at home. All of a sudden, her condition got deteriorated with the signs and symptoms of redness, swelling, and she had a severe pain on her ankle. So thereby she got readmitted into the hospital, and she was found to have cellulitis. So the cellulitis is the current condition, current diagnosis of the patient. Thereby she received an antibiotics, analgesics, and also she suffered with the increased body temperature, non-compliance with the medications and oral intake. So these all was treated conservatively, and she showed some good sign of recovery, and she started to mobilize with the walking frame. Now we are writing a letter to the community nurse to look after her by doing a home visit. So what the community nurse has to do? So she has to do a home visit for her, and she has to monitor her wound dressing, and also she needs to be check the pressure care, risk of pressure ulcers, and also she needs to be monitored the improvement of the cellulitis. Apart from that, she can monitor that she is compliance with the medication regimen, especially antibiotics, and also she can assess her condition, is she well able to back to the compression therapy. And apart from that, she can arrange equipment such as like a cushion and to elevate the legs to enhance the blood circulation. So this was the overall case note. Now we are going to make a draft letter. Okay, so let's do that. First, as usual, writing the date. Here they have given the date since the January. They have been giving the same date. The date was like 8th of January 2022. So we can write that date, which means today's date, in the letter they have given. So 8th of January 2022, we can write it on the top of the letter. Then we are writing the address. So the community nurse only we are addressing this letter. So we are writing the community nurse address, then salutation, and then patient name Mrs. Briley Boswell, and what is the age? 76 years old. So now introduction. How to write an introduction here? So three things to make an introduction. One is patient full name, another one is what is the current condition of the patient, and third is what is the purpose, why we are writing this letter to the community nurse. Okay. So here we are just starting. This is to request a home visit for Mrs. Briley Boswell, who requires your continuous monitoring and wound care management. Full stop. She is recovering from cellulitis. So that's it. Because she is going to do a home visit for what? Either the dressing is in appropriate manner, and about the wound care and all those things, and she is getting improvement from her condition. So that's why we are just we are just recommending her to do a home visit. So that is the thing, we are writing it as a purpose. Rather than writing the continuity of care and management, we can just write it in an advanced way. Like somewhat we need to show some uniqueness in our letter compared to others, so that it is good to write continuous monitoring, because she has to monitor her risk factors of pressure ulcer as well as medication compliance, and also she has to do an assessment on her wound care, isn't it? So thereby we can make an introduction like this. So this is to request your home visit for Mrs. Briley Boswell, who requires your continuous monitoring and wound care management, full stop. Because why? She is recovering from cellulitis. That's it, because that is her current condition. Now coming to the body paragraphs. So here two confusion will be coming to each people. Either should I write the current admission history of the patient, or should I start from the beginning of the old history of the patient? So what was the old history? Patient was having rheumatoid patient was like suffering with the arthritis, right knee arthritis, and because of the arthritis the doctor suggested her to undergo for the total TKR, and she was waiting for that surgery. Unfortunately her condition got deteriorated with the worsened symptoms, and also she ended up with a venous leg ulcer, and thereby she started with the compression therapy, and because of that venous ulcer now she suffered with the cellulitis. So these all are the secondary reason for the patient to develop cellulitis. So these things should be comes first rather than writing the date of admission and signs and symptoms of the patient. Okay, so how we can start the body paragraph now? So we can start the body paragraph like Mrs. Boswell. So from the body paragraph onwards, we used to write a second name of the person, isn't it? So here, Mrs. Boswell. Mrs. Boswell has been under the treatment, has been under treatment for right knee arthritis for longer period. Therefore, she was suggested to undergo for total TKR. Unfortunately, her condition got deteriorated with the worsened symptoms, and she ended up with a venous leg ulcer. Consequently, she was suggested to have compression therapy at home. So this much we have to write in the first paragraph. Then the continuity of the same paragraph we can start on 3rd of January 2022. She was readmitted to the hospital with the complaints of redness of the ankle, swelling and increased pain on her right ankle. On assessment, she was found to have increased body temperature. And also she was diagnosed with the above mentioned condition, because the above mentioned condition is what? Cellulitis. Then what they have done, for which she was treated with the analgesics and antibiotics. Apart from that, her symptoms were treated conservatively. Then we are writing, as she showed good progress in her condition and started to walk with the help of a frame, she is being discharged on the date of discharge. We are writing it. So that's it. It is very simple. But here only the thing we have to make sure, her previous history which is connected to the current history, current condition and the current diagnosis. So that has to be written first, and then you have to write the admission history. If you write the admission history, there will not be a continuity of the present medical history. Okay, now coming to the point of your social background. So social background, as I mentioned earlier, that Mrs. Boswell lives alone and has hypertension and is on amlodipine, or else she is on amlodipine for hypertension. She uses hearing aids since 2010. That's it. This is more than enough for the community nurse to know about the patient. Now coming to the recommendation paragraph. So what this community nurse exactly do to our patient, what she has to do. So here she has to do, so we are just starting in view of the above, or like we can just start straight away. It would be greatly appreciated if you could do a home visit and perform frequent assessment of dressing to check improvement of the cellulitis. Then we are just mentioning that most importantly, please monitor her pressure ulcer risk factors. Now, and the second thing is, kindly supply her equipment with a soft cushion, because by doing a leg elevation to improve the blood circulation, and it would be highly beneficial if you could monitor her medication compliance, as she is prescribed with flucloxacillin 500 mg 4 times for 7 days, because when she was at home and she was not compliant with her oral intake as well as the medication. So that is why we are just telling the nurse to monitor that she is compliant with her medication regimen. And at last we are just saying to her, kindly assess her that she is fit to transfer for compression therapy, because she was on compression therapy when she was suffering with a venous leg ulcer. So after the admission to the hospital, it was stopped. So that's why we are advising the community nurse to recheck that she is fit to go back to her compression therapy. Okay, so this is the letter. I hope you all have done in a very good way. Hope for the best result. And whomever wants to join in our class, you can contact us at any time. Our number has given in our description. Okay, so we have a crash course and we have 10 days, and we are just separately taking writing and speaking 4 modules and 40 days, 30 days, 20 days and 60 days, even further classes for the beginners. So whomever is willing to join in our class, it's our completely online class, so you can contact us at any time. Okay.